Good evening, friends, and welcome to the show back to Mirror Wisdom Reflected. We had some very exciting and very interesting and intelligent people on our show. So, also, we promise to be the next 45 minutes to 1 hour to a great, enchanting illustration of what can be done. Here in Mirror Wisdom Reflected, I'm acting like a mirror to reflect the wisdom from all our people who come on the show. They are extremely well acclaimed. They know their job well. They've been pioneers in their field. They have a lot of stuff in them. They've spent decades to get into the best part of their life into this. And they've really struggled well to achieve where they have come. Beauty is an absolute thing, and ageless beauty is a classic thing forever. Beauty lies in the eyes of the beholder. We all understand, and whether we like to be pretentious about it or we philosophically try and say that, beauty is skin deep, but let us all accept it that any person in any room, in any party, in any get together, in any meeting, in any interview, the first thing which strikes is, of course, the aura, the presence of the person, and the beauty that walks into it. It's not just skin dip, that's what we are going to discuss. It starts with that. The first approach, from the time they start walking, the dress, the way they are made up, the flair with which they walk, talk. And remember, friends, beauty is not just skin deep. Why am I saying this? Because light travels faster than sound. There are times when you are very impressed by a beautiful girl and or a handsome looking boy, but the moment they open their mouth and start speaking the first sentence, the whole concept changes. Definitely, light travels faster than sound. So it's not beauty which is just skin deep. Some have had the lottery of being born the most prettiest and the most beautiful in the world. But if the mind does not cope up with it, if they don't have the flair to have that together with it, they'll not be able to carry themselves. To get us into how beautiful it is, skin, the outermost layer, which is the largest surface area of the human body, which is being regenerated ever so often in the couple of weeks that we always regenerate. We were never what we were 6 months back. We regenerate, we degenerate, we rejuvenate. And to understand the concepts on skin and how can we make it everlasting, how well we can take care of ourselves. Because the skin, like the eyes, reflect what we are inside. If we are dehydrated, if we are not in the best vitamins that we have, if our bones and the muscles are not the correct posture, the skin will lag. And to give us more details into this, we have a very, very reputed person with us, Dr. Jamuna Pai, the first to venture in the fields of aesthetics in India, and of course, one of the most sought after celebrity doctor in this country. She has 9 clinics across by the name of Skin Lab and has more than 21 years of experience in aesthetic injectables. I'll come to this later. She's referred to as the pioneer cosmetology in India, and she has many firsts to her name, from Botox in India 2000. That means she's the first one to introduce Botox in India. Now that is very commendable. We'll find out what Botox is, the good, the side, the bad about Botox. Various laser treatments, LASER, laser is light amplification and stimulated emission of radiation, including the Cool Sculpting Advantage series. In the skincare expert for the international beauty pageants for almost 25 years. And she's an international trainer and faculty at many scientific conferences across the world, including the IMCS, the ICAD, AMWS, Cosmetica, and DESIL. And to her name, she has a beautiful book, No One Has to Know, on anti-aging. Ma'am, welcome to the show and thank you for sparing your valuable time and thanks for being with us this evening.
Thank you, Himanshu, and thank you to the team that has welcomed me today. That's really very kind, and it's an honor to me to be on your YouTube channel. I went through it in the last week, and I was quite impressed with everybody who has come and spoken here and shared whatever is their subject. And thank you so much.
Ma'am, what is your definition of beauty? You now that you know beauty pageants and
I just thought that you have made my life easy today. Whatever it be, however many years you've spoken before that particular act of yours or the speech of yours, there's that little thing. I said Himanshu has taken care by saying everything that I wanted to say. So Beauty for me, and especially now that, ever since we formed the panel for the Miss India, I used to do all the girls who used to go for a pageant, but now I just take the top 5, 6 winners that go for international pageants, those who win here, the top 3, and then go. I prepare them, I mean, skin wise and aesthetic wise. But one thing I have noticed, whether it is at a beauty pageant where they should know what they're doing, or else, like you said, in a simple room, at a conference, at a party, anywhere, that beauty is when that person has grace, as walks into the room, heads turn, and of course, heads continue to look in that direction when she opens her mouth, because she is speaking well, and everything goes with the persona that she is. And she, kind of emanates that kind of an enthusiasm. What would you say? That I feel the whole personality, the jubilance of the person is what is beautiful about her. She gets everybody around her, kind of to give her that look. And that is not only because of the external appearance. It is the whole personality. When we are training the girls for our international pageants, we always, of course, we've got a whole team. Sabira Merchant, she teaches them how to answer. I do their face and whatever. We do body parts also now. So the thing is, we as a team prepare them for an international pageant so that they go and they represent India in the way that you are saying. Our girls really have beauty with brains. They like the color of our skin abroad. So wherever we go, India definitely stands in the first 10. And this time, Miss Universe, Adeline Castle, she stood in the first 5. So she answered so beautifully. So it is just not, beauty is not about having the right figure or the right skin and the right hair. That, of course, gives you the added advantage and the edge.
Great, ma'am. That is something interesting. But before we get on to anything else, next time you go for all these beauty pageants, you need assistants to carry your bags. Please let me be with you.
I wish I was invited, but yeah, I'll definitely take you.
So that's a very important. Seeing these pageants and the way they are grown and they are trained. Everybody is trained the same way. Everybody has, to reach that level to represent a country. Most of them are at the same level, and if at the international level also, they're almost the same. There is a slight difference. It's like being in the Olympic, a fraction of a second. How could you be first and second?
Correct.
What is it that makes a difference between the first and the second, or somebody who is the runners up and who loses a game? What is it that you found in your experience?
So that's what I said. Our Indian girls have the little edge because they don't need translators. They all speak very fluent English. And if at all there are any glitches anywhere, the team makes sure that they go well prepared. Their confidence levels. I always tell the girls that the confidence with which you throw yourself forward, you walk, that itself wins you half, the most of the crown. And so this, as a group, I know I have seen the full pageant, all the 29 or 30 girls, but India has that edge because I think the color of our skin, the depth of our intelligence, together with their looks and all the beautiful clothes and the paraphernalia that go with sending them for an international pageant from India, I think gives us that little edge always.
Brilliant. Thanks, ma'am. But to start with, what is the right age to start taking care of your skin?
Okay, so here goes. This has changed over the last maybe a couple of decades, where we felt at our times that 35, 40 chalega, when the hormonal changes started showing on our skin, maybe that's the time we felt if it is too dry, it's trying, looking as if it's wrinkled. Oh, what should I do? But today, the mantra is, thanks to all the competition, the pollution, like I said, the competitiveness, the peer pressure, everything. people want to do, the kids today want to do so many things. You yourself said your daughter is a doctor and her husband is a doctor. She helps you run your hospital, and your son has a startup. So you can imagine how much competition there is. So the skin also takes its toll. They work late into the night. They're on their computer most of the time. Now, many people say, when I tell them that during the lockdown, please use a sunscreen, even if you're indoors. So they say, but why, ma'am? We have, we put the curtains down. So because our the maximum time during lockdown is spent looking at our tablets, our iPads, our television. Netflix, of course, has become our new partner, the phone. So all of these emit this blue light, which is harmful and aggravates it causes dryness of the skin, increases the pigmentation, helps in causing wrinkling. So either get a protective guard or wear those, you'll be able to tell more, wear those protective shields around the eyes. But yes, so I think the anti-aging schedule should start, the regime should start in the mid-20s. Yeah. So simple things. So as with passing decade, it gets, more and more intensive. So we'll be adding, ingredients that are stronger as they grow in age, or if they have a particular kind of a skin.
Interesting. So even the covered part, when you're wearing clothes, those parts also needs to have any kind of treatment to be taken care of.
The sunscreen, no. I feel if there are no open wounds, lesions, acne, India's very famous coconut oil does the trick of kind of giving you a protective barrier or a shield by which you're preventing loss of moisture from the skin. And and the drier the skin, the darker it looks, and more importantly, it ages faster. So a person who has oily skin has the advantage, may have a few pimples and a few acne pits, but has the advantage that he or she will grow older slower than person having a smooth, nice skin, but dry skin. So, so the coconut oil does the trick. And otherwise, covered areas, you can just keep it moisturized after your shower, after with the coconut oil, pat dry, add a little body moisturizer or a body lotion, and that's enough, unless there is a problem.
Very, very interesting. And how much water should be drunk for the skin to get regularly?
Okay.
Yes.
Yeah. So 2 to 3 liters is the standard. Now, when people do detox and all that, they drink more, but then 2 to 3 liters is sufficient. And the best way to remember whether you're taking that much is, I used to think I'm drinking a lot of water till I realized when I measured that it was hardly a liter, because I was drinking 5 or 6 glasses. So I drink 1 liter at home and I carry 2 to work. So I know that even if I don't drink half a bottle or I don't finish, I know I've drunk between 2 and 3 bottles. So that's a good way of remembering. Remember that it helps in your digestive system. I mean, it helps with your constipation, helps in diluting your sweat so you don't get any smell from the armpits. Your urine, it is not concentrated. So a lot of good things happen with water. And so I think it's a very simple, nice thing to put into your daily regime.
So now, ma'am, there is on one part we will dehydrate if we exposed to UV light and sun rays. But if we don't get our vitamin D. Now, what is the way out? A lot of women who don't want to go absolutely be exposed to sun because of pigmentation or because of skin, and they don't get their vitamin D. What is the optimum way out in this?
See, one of the interesting things that I wrote in the book is I realized over a period of so many years, I mean, when I wrote the book, it was 21 years of my practice. I realized that whoever we sent for any test, we started adding a B12 and a D3, and we got a deficiency or an insufficiency. So everybody had to be treated. So once when my father was at home, and that was me, my grandson, and so we were 4 generations, and we just did for the heck of it so that I could also write in my book. You won't believe all of us had my grandson who goes out to play in the sun, me who's hardly exposed to any sunlight. So all of us, my son who gets medium sunlight. So I think we do find ourselves deficient in B12 and D3. And the best way to do is at least check and take the supplements, because we know how important they are in our day-to-day life.
So you would recommend, whether you're exposed to sun or not exposed to sun, check your vitamin levels and do take your supplements. Don't hesitate.
I think so. It will make a huge difference in your life.
Yes. So being an ophthalmologist, I can tell you from the eye standpoint also, vitamin D, B12 makes a big difference, and a lot of problems can happen, not just vitamin A. So
Yeah.
also your bones, your muscles, your all other, and even for COVID right now, good
Correct.
amount of vitamin D, vitamin C, vitamin B can help you get healing better faster.
Mm.
So get your levels checked routinely, friends. And if they are low, not just your skin, it's not skin deep, but your bone, your resistance, your
Correct.
immunity, all that will be better off by having your vitamins. With respect to, ma'am, classically 30s to 40s, as you said, women have problems with their skin and they are very sensitive about that. Pigmentation. Would you like to elaborate something on that?
Only the pigmentation or other problems also?
Other problems together with that, because that's when you said, by default.
Yeah, they start getting a little conscious, and they do come for advice. Some of them come with a huge basket of products that they've got at the airport and when they have traveled. And then mostly they are duplication of, I feel that we should keep the routine as simple as possible. So there is something called a routine that you follow. You have to cleanse your skin because you have to get it devoid of at night.
Do we use soap? Now comes a very important point. Soap and shampoo. Cleanse the skin, you said. It's plain water, or should you use any kind of chemicals?
See, now there are people who believe that they only wash with water. That's a very tiny percentage. Some people say हम दूध से सिर्फ धोते हैं. So that again, if it is a normal to dry skin, दूध से धोना या उसकी मलाई से लगाना, it's okay. But living in a hot tropical country like India, most of our cities having a hot weather, humid weather, I think use of a soap, one that suits your skin type, is a very good idea. So soap or a body wash or whatever suits, that helps you, makes you feel clean. When I say, when I ask a client, okay, you're using an X brand, okay, then I say, does it clean your skin? I won't change your brand. I've got my own brand, but if it does what it is meant to do, you will continue with the same. That means without it making you feel dry, without, when you wash sometimes, it strips your skin of all the oils and whatever else, and it changes the pH and you feel the tightness. So if they don't feel that, that means that is their product. We're not going to do anything with it or advise anything else. So if it does that tightening effect, that means they have to change their product. And also with change, not only with changing age, with changing seasons, the skin also changes. So during certain seasons, you see that there is more pile up of the dead skin cells. Otherwise, then there is hot and there is cold. There is open pores and there is normal pores. So according to that, we are going to change. And what change? We Indians do not believe, except unless we are in the glamour industries, we don't believe in wearing too much makeup. Okay. I think most of us are blessed with good skin. When you travel abroad, you see that they have a lot of lentigines. That means a lot of freckles. They have to cover that up. They have a lot of acne scars, which is prevalent in India also. But yes, all those need to be covered. But otherwise, on a daily basis, what you need is clean your skin. Clean your skin clean. Okay. Many people ask, is a toner necessary? I will answer before that question comes, because they have that CTM, that is cleansing, toning, and moisturizing. That is a 3-step program all over the world that they use for cleansing of the skin for a routine. Now, toning, now there are many alcohol-free, but in the past, they used to have alcohol. So when you clean, and then if you have a normal to dry skin, you're making it drier because the alcohol evaporates and dries the skin. But if you are having a very oily skin, or you're one of those people who's doing 2 shifts or 3 shifts in your Bollywood, and then you have lots of makeup at night, you have to cleanse it. It's nice to use after taking it off with any oil or anything, a cleanser, makeup remover, remove it, use a toner, and just cleanse it so that all the deeply embedded debris and the stale makeup, everything comes off. The skin is all clean and it is ready to receive the active ingredients that you're going to give in the night that they're going to apply. At each age or each problem, it may be a different active ingredient. One will tighten the collagen or cause neocollagenesis. The other one will disperse the pigmentation if they have a pigmentation problem. The third one has some other effect. So all hydrating effect, if it is sodium hyaluronate or anything like that. So then you are making the skin all ready to imbibe all that you're putting as an active ingredient and leaving over for 7 hours when you sleep.
Very, very important. Now that you mentioned about the skin and that it should be cleansed, I'll just clean up with the eyes also. A lot of women have the habit of applying mascara eyeliner.
Right.
They don't clean at night. The meibomian glands don't get a chance to get cleansed up, and the glands suffer, and you do not have a lipid layer secretion in the eyes, and that can
Absolutely.
give rise to dryness and infections in the eyes. So, cleaning up any kind of chemicals applied in the form of mascara, eyeliner, or a pencil should be done every single day before sleeping. Is that correct? Is that what you would recommend?
Yes. So especially around the eyes, Himanshu, is because the molecules used there, the mascara, for example, compared to what we put on the face as maybe a powder or a compact, those molecules are really very thick when you apply a mascara, and they're not very easily soluble. So what happens is you have to use the eye makeup pads, which are a little different and can dissolve, and leave it on the eyes for some time, then wipe it along the lash margins. It takes about maybe 30 seconds to a minute, but you are doing a good job with it. And then you wash it all off, and then you have a very clean. Do it again if you wish, but that's how it is done for the eyes.
I think it's a very important, simple tip in life can avoid a lot of eye problems in the long run and can keep the eyes glowing and shining. Ma'am, with respect to hair at this point when we are touching this, how often it is important for, men have a habit of washing their hair with shampoo every single day. How,
Men have, yes.
yes. So, and what is the recommended, and would it harm? Because it's dead. Finally, hair is a dead substance. You need to hydrate it. It doesn't have its own hydration. So how would you tell people to take care? You've been very biased. You've been talking about females all this, and you're talking to a male. So I'm going to ask you a few questions on the male brethren also.
No, but hair is common too, whether it is male, female, kids. So, taking care, I would always say when they say, how many times should I wash my face or how many times should I wash my hair? I always say it depends. It's use your own discretion. The moment you feel, I mean, if it's a teenager, young teenager, obviously the mother has to supervise. But otherwise, they decide. And if they want to wash every day, some of them don't wash with soap every day. So, or shampoo. Now, what happens is you can wash every alternate day with a shampoo. You can wash every day, no problem. If you are into sports and you sweat a lot, and there's a lot of you feel this, it's secreting too much of oil and sweat, dead skin cells, forming of dandruff, itchiness, you can wash every day. There's no problem at all. If the hair feels dry or this, you change your shampoo or condition it with anything that you want. Or another good idea is just take a simple, like I say, that's my favorite, coconut oil, and just apply it the previous night and sleep and then wash it off. It's a good conditioner. And for ladies who are using a lot of heat, color, straightening agents, perms, touch-ups, all those, any chemical, the hair ultimately has 3 layers. The outermost layer, I mean, all these layers, outer layer is supposed to be like the scales of a fish. They're supposed to be flat, and that's when they reflect light, and that's when you see that it is healthy hair, because it is reflecting light, just like the skin. When your skin, Himanshu, your skin is reflecting so much light. So yours is a healthy skin. Okay. And always health is from inside out. Beauty is from inside out. Okay. Now what happens is, sorry, where were we on this hair? How are we going to take care of the hair? So you just take your coconut oil and the previous day and you wash it off. And these scales during color, if they're like this, and if you're coloring your hair, you're heating the hair with blow drying or with tongs or for any other chemical treatment like a perm straightening, it has to lift its outermost cuticle layer, the cells, in order to let the color or the straightening agent go and reach the center in order to bring about the change, whether it's a curl or whether it's straightening. In the process, the hair becomes all spiky and unmanageable. And so it's called porous in hair parlance, in a beauty parlance, it's called porous hair. Actually, it is very frizzy hair. Now, this frizzy hair is because the outside cuticles are all tired and worn out and dead, like you said. And so how are we going to condition it? Simple, this thing. If this has got lifted, this has got to be pushed down. So the easy method that parlors use is they use iron and flatten this with, you must have heard of a hair ironing. So they flatten the cuticle outermost layer. That starts reflecting light. It looks very nice and shiny, but actually that is not so. So you can make homemade packs and apply it. You can use, again, coconut oil the previous night. It will calm the outer this thing. Otherwise, you have all the conditioners in the market that just use at the ends and very little at the top, or the little flatten your hair. Won't look good. And you just leave it on for a couple of minutes and rinse it off. And you will see they're meant to, again, flatten all the hair and leave it smooth.
How often should one exfoliate their skin? A common question.
Yeah, that's a good question, because exfoliation is one of the most beautiful, gratifying results that you get when you exfoliate your skin. Because as we know, the skin renewal cycle, I mean, I don't know whether all our doctors listening, but in your youth, it is roughly as old as you are. If you're 25, roughly we say once a month, the skin undergoes a renewal cycle. So once in 30 days. But as you grow older, 50 and 60, like everything else, this also slows down the cell renewal cycle. So more and more and more gets piled up. Now, when there is a debris, which is uneven, not nicely piled up, then obviously if the rays of the light or the sun is coming, it has to pass through all this to reach the skin. So it's going to crack, break, and so it is not going to reflect. Science, simple science of physics, okay? So then you don't see it. So when you get this, when you use either a microdermabrasion or any homemade pack from your kitchen shelf, which I'll give you for a few examples later, which has a little, if you don't have too much of sensitivity of the skin or open wounds and acne or herpes or anything like that on the skin, you can use this and leave it on. And when you wash it off, you see that most of the dead skin cells have been washed off and your skin starts reflecting light now. So exfoliation, because it does not build up so fast, you will be abrading the normal skin again and again if you're going to do it every day or every second day. So it is good that it is done once a week or once a fortnight.
Brilliant. So that is very important. Exfoliation is a must, but depending on how your skin is behaving, one should be doing that once a week or once a fortnight, not ever so often, or else you'll get a lot of cracks in the skin.
Yeah.
And what level of SPF should one wear for the sunscreen protecting factor?
Yes.
Percentage. What level?
So 30 in India is a safe enough this thing, but they say that 30 to 50 is very safe. Some say I've got 60. I say very good. Please use it. The thing about sunscreen is whether it is 30 or 50. It's very important that at least in the hours that we are exposed to the sun, not directly exposed, even indirectly, then once I tell a simple method of using sunscreen, using it is a must. As thick as possible is a must. See what suits you and doesn't make you uncomfortable. Otherwise, it will distract you throughout your working day. We don't want such a thing. So there are different kinds. So then use once in the morning after your shower and one more time after your lunch. So it becomes easy to remember. Ladies carry their bags to the washroom. So again, you're saying I'm talking about ladies. So men can keep it on their desk. And if your skin is not too oily, you can take another coat in the afternoon and just pat it dry on the morning coat without washing. But you're protected because the morning coat does not work beyond 4 to 5 hours.
Correct. That's very important. That most of the treatment, even anything with the hair, also 3 to 5 hours, that would be working. We need to do whatever that needs to be hydrated ever so often. Now, the commonest problem that a lot of women have, 30s, 40s, 50s, is pigmentation on this face and various kinds of. It's not just we know SLE's kind of pigmentation or any other kind of, but
Yeah.
routine pigmentation that they have with hormonal changes. What would you say, and what is the treatment? How to avoid it?
How to avoid it? I wish there was a way to avoid. Everybody would have wanted to avoid. It's a very common, complaint in India. One is because of the high concentration of melanin in the skin, the color, the pigment that gives us color to our skin. So because we all are skin of color, we are called. So our color varies in all the shades of beiges, okay? But that is the melanin that gives the color. But certain hormonal changes, starting with puberty, then going on to the pregnancies, I'm talking about in women because you said in women. Men also do get, but not as much as the women. And during the pregnancies, and then it usually goes post a pregnancy. And then again, perimenopause, that means around 40, 45, or post menopause. Definitely, most people, there are some people who are blessed and do not get pigmentation at all, but they get, some people are very uncomfortable because, like I said, we are not very adept in using the makeup. So they do not know how to hide. And all of us really want to wash our skin. This thing, now that everybody's talking about a sunscreen, use a little sunscreen and moisturize, and that's it. But if you have pigmentation, then you will need a concealer and or feel conscious about it all the time. So then the things that you can do to prevent its spread is use a thick coat of sunscreen at least twice in a day. I told you at 4 to 5 hour interval. Made it easy, once after your shower and one more time after your lunch. I feel that even if you are driving or if you are in any vehicle that where you can use a cotton dupatta. Everybody knows what a dupatta is. So just fold it, cover it up till here. It not only looks beautiful like Benazir or whatever, just pull it over your thing, but not if you're driving because you need the side view. And then so that because the pigmentation is always on the highest part of your face, on the high cheekbone, the nose, we do not want the side, the sun's rays coming from the side and hitting it. Every time the sun's rays fall incident on the skin, please remember the melanin comes up as a protective mechanism. And so you get more and more pigmentation, especially if you're using a cream prescribed by a doctor or going in for a treatment. This becomes sensitive, and the sensitive skin in the day when you're going out, that absorbs more UV rays than this where you're not treated. And so the melanin comes out even faster here. And people are wondering, I'm going to the best doctor, I'm doing what they are saying, and still my pigmentation is growing darker and darker. So taking care of it, wearing big, glares, using some cotton, this thing, using a coat of sunscreen, taking a lot of vitamin C, taking other antioxidants, all this will go a long way. Your sun exposure time, limiting it to whatever late evenings and when it is safe from the sun. 12 to 4 is not such a great time to be out in the sun.
What about Q-switched laser, which is gaining more popularity? What is this Q-switched laser?
So this Q-switch laser is a laser that it is very simple mechanism, and it zaps the pigmentation. But where pigmentation is of like a medical origin, then it is very difficult to promise. We've had many trials with this. But if a normal skin or with very light pigmentation goes for a Q-switched, then they definitely get results with a Q-switched. But you have to go for regular treatments, and yes, it also bleaches the hair on the face, so then that is an added bonus. So the
How
Q switch
often?
is a good. Then soft gel peels are there. People who don't want their skin peeling for 7 days and then having a home regime, which is really good, these treatments. But if they want lighter things, where they may have restrictions at home, or they may have a very busy lives where they don't have downtime to peel. In such cases, you have soft gel peels, and then yeah. So
How often should the Q switch laser be repeated? Or
the Q switch laser, you can do it even once in 15 to 20 days. There's no problem. Yeah.
wow, so often is it?
Yeah, you can do it once a month for all treatments. We say once a month is safe because your cell is also kind of regenerated, and the new cells are receiving this thing, and this is healing whatever you have done 1 month before. So for most treatments, I would say resurfacing lasers that we have, everything go after 1 month. Now the whole science is that the collagen, as we age, what is skin thinning is when the collagen in the skin thins down, when the underlying subcutaneous fat layers, which give us the chubbiness in our youth, they start migrating or thinning or disappearing. Okay, the ligaments that hold all these things together upwards, they start going south, and then of course there's resorption of the bone also. So all the 4 layers are affected, and that results in aging. Now when you're talking about the collagen and elastin, so every treatment, whether it's a heat treatment, using radio frequency, whether it is using ultrasound, or threads. You must have heard of Koreans. They kind of invented using absorbable threads for giving you a lift in different direction, in the upward direction, whichever way you wanted, whichever part you wanted lifted. Okay. And so the principle always is the same. We also do tiny micro needling and many such things, vampire facials. The thing being that you are irritating the skin. You are either putting a foreign body, you are causing little punctures and teasing the skin to produce more, collagenesis. That means it produces baby cells and more collagen. And that is the whole trick. Whether it's an absorbable thread, it absorbs. It's treated as a foreign body, so the body sends its cells, and then it forms the skin. So all these, the heat, for example, the heat does the same thing. The ultrasound, it uses ultrasound, that also does the same thing. So the principle today in anti-aging procedures are so many.
So the new treatment Profhilo, which is there for this, how good is that? Is it worth doing?
So we are running trials, frankly. I was a little late in starting the trials. I myself have taken it all over the world. I know because we get a lot of international clients, so they have taken it there. It's a 5-point program. And then it is programmed in such a way, the molecule, that it only hydrates the upper layers of the skin, which is very important because internal, deeper layers of the skin, below the fat, mid, whatever, subcutaneous, everything, there are different, molecules of hyaluronic acid, and likewise cross-linked or otherwise, which go and hydrate or fill or shape, sculpt. But the one that does the skin is the Profhilo. So it is once a month. You do at least 2 treatments to see a good result.
And what about vitamin C serum?
Vitamin C serum, you have the stabilized ones that you can use during the day, even in the sun. I mean, you can use that with your sunscreen, and they work because they are antioxidant, which work from outside, and they have a healing effect. And so it works very well on pigmentation, in cell rejuvenation, in reversing the clock, in short.
Before I go to Botox, ma'am, one of the important questions for both males and females, especially male pattern baldness and females losing hair. We all start losing hair after a particular stage in life. And what is it that we can do to prevent it beside the genetic lineage? What kind of proteins, what food to be done, what chemicals to be used for either male or female for hair loss, and how to avoid it?
Okay, that is a good question, Himanshu. But the bad news is that if it is an acne client that comes in, male, female, any age, even adult acne, not necessarily a young male or female, I always tell them I'll give you 100% results. And the scars also, mostly, I will help you take them out completely. When it is pigmentation, I'm talking about the three major this thing, broad outlines. When it is pigmentation, I tell my patients that okay, promise them about 40 different multi-pronged treatments, and they get about 60-70%, and they're okay. When it comes to hair fall, hair thinning, hair this thing, of course we find out what could be the cause. The causes I'll tell you, enumerate, but I tell them I can give you 10 to 20%. Don't expect that you're going to get a full head of hair because you have come to a clinic or to a doctor. Now, the thing is, firstly, genetics, as you know, as we have seen all over the world, that if there is a receding hairline and if it is, or the hair is balding at the crown. So this is very difficult to treat. What we can do is find out if there is a thyroid, a low hemoglobin levels, if there is a local infection, if there is any other deficiencies that is causing hair to fall. Proteins, not enough protein taken. So a protein is said at 1 gram per kilogram body weight. But again, you have to check with your physician. Do not go generally by a blanket this thing, but that is what is taken. And hair is all protein, nails are protein, and other things like peptides and amino acids and all these things will definitely help. Iron. So coming back to the hair, we have vampire treatments. What we help is that by certain topical lotions, we help them stop the fall and hope that no more continue falling, and they can, at least that's what most of them say, before we go to transplant, which is the only thing that gives permanent results, which we can promise. You don't have a hairline, I promise you I'll give you a hairline. Just let me see if you have donor hair, because if you don't have donor hair, I can't do autologous hair transplant. Okay, so I can promise them that is the only place I can promise that I can help you. But otherwise, I can help them improve the texture of the hair, stop the hair fall, find out the cause and treat the cause so that it does not recur again and again. Okay, prescribe all the multivitamins, check what their scalp condition is, if they need any, and
What about
whether
seborrheic scalp condition? You have seborrheic dermatitis, and you have
seborrheic dermatitis is not something like you must be already knowing. That's not something that will go away because you are using coal tar shampoos or because you're using some steroid based cream for any itching anywhere on the face or eyebrows or any scaling of the hairline. But you know that when you're using the medication, that it will go away completely, at least the symptoms. So seborrheic dermatitis is not something that will go away permanently. So it's best to tell the client before they go from doctor to doctor. But yes, in transplant, and a lot of people are realizing that and realizing how important a hair, the role the hair plays in your looks and confidence. Like you said, you enter a room and you enter, please don't get me wrong, even a person who shaves himself completely off, bald men, it's just how they walk, the confidence in their gait is what sets them apart. But still, a man with good hair is always a man or woman.
Absolutely. Very well said, ma'am. Now that I'll come back to hair and what best proteins and whatever that. So hair transplant is safe, right? There is no misnomer about that. It's your own autologous hair which is being transplanted from your own garden,
Absolutely.
from the
Yes.
backyard to the front yard.
Yes.
So,
So a lot of women are coming today to get their hairline. You can see how broad my hairline is. I'm going to be, next time when you take me on the show, my hair would be like at least maybe 3/4 of an inch down. But so jokes apart, even those who have the parting that is showing too much because they've lost a lot of hair at the front of the hair, we transplant even there.
what is weaving of hair? as against,
Yeah, so hair weaving, some of the celebrities we have seen, and the process is that it is non-surgical completely. So what they do is, suppose someone has a bald patch here, round. So the person who is the expert in hair weaving comes and measures, the dimension, the diameter of the piece that he or he's going to make for the patient. And what he does is, once the piece is ready, depending on the type of hair, I mean, what kind of hair, color of hair, and texture of hair, he matches when he makes his piece. If it is male, obviously it will be shorter hair. And for female, he asks about lengths. And then what he does is, so every month, instead of going for your haircut, you have to go to the same person who initially has braided your hair in that round and taken this piece and stitched in the braid. And then he has given you a parting, because the underlying mesh or the net on which he has braided is skin colored. So he gives you a parting and it looks really natural. And then he cuts your hair to blend with your other hair. So those who don't want a surgical option, but it is very tedious going once every month to get it done, because what will happen if he doesn't go every month is his own hair grows and the piece starts moving on top.
Interesting, interesting. Running short of time, but now the important thing, Botox and fillers, something very close to your heart and the one who pioneered in this country. How good, bad, ugly is Botox? What is Botox? When should it be done? Who needs it? Which areas of the skin that needs Botox?
Good, bad, ugly. If it was bad and ugly, I would never have brought it to India. But yes, when the company asked me, Allergan, that would you be interested to get Botox? It's worldwide. It is popular. We read about it. My husband was there. My husband and I. And we decided, why not? If people are taking it, those who are volunteering will take it. And so we got it into, I mean, I got myself trained and we started. Of course, people were very scared because they used to call it a poison or whatever else. It causes paralysis, it all those negative words, which we were trained to say that it is a protein complex, not poison. It relaxes the muscle, not paralyzes. So, just to calm the people. But coming back to which are the areas that we know very well that if there is a frown, I don't have anything because I've been Botox, but if there is
Nice of you to admit. Nice to see that.
So over a period of time, this question definitely your viewers will want to know. Over a period of time, like over about 20 years that I have taken, the dose became less and less. You won't believe the last Botox I took, maybe about 8 units, where we need about 30 units, 40 units for the upper face, the glabular complex, around the eyes, the crow's feet, okay, and the forehead lines. You can't see any lines in me anyway. So every time over the years, not the second time or the third time, over the years, your frequency becomes less and less, and the need, because the muscles are used to being in a state of relaxation. So you can see that I'm not paralyzed in any way. My faculties are not in any way affected. I answered all your questions straight. But yes, which are the areas?
Yes.
The crow's feet. The crow's feet, the glabular complex, the forehead. Many people have forehead lines like waves, even when they're very young, because it runs in the family, because the skin is, and the frontalis is not so firmly adhering. And so, but there are many other off-label uses of Botox. We do it for, kind of making the jawline thinner. We use it for lengthening the chin. We use it for making the a happy smile. We use it in migraine also, though it's an off-label indication. And many other the new indications, old indications they are, but we have started doing in India recently, is shaping the legs now in summer. That is quite also hyperhidrosis. That means those who sweat a lot on the hands, it becomes a social, what would you say?
So, Enigma, you shake hands with a person who's
Yeah,
already
it's
sweating.
sweating. Yeah, it is a social
Yeah,
taboo.
yeah.
So then, um, done every 6 to 8 months, it completely takes away the sweating, and we have these people who are really regular, because men especially, and underarm sweating in women. So there are so many indications that just go on and on about Botox. It's
Is there any
unbelievable.
downside? The biggest thing still people are wondering, is there any downside that if you start using it, can you stop it? What if you stop it? And any downside or
That
side
is
effect?
a very often asked question. um, we have done our own studies and seen that over a period of time, we have seen pictures, even those who have stopped taking Botox for whatever reason, we have seen that they look much better than their pre-picture when they first came 6 years ago or 10 years ago. So it definitely does not make it worse. Many people think, Acha, aaj liya because it is my son's wedding in 2 weeks, but I don't want to take it later. Will I look worse? As we say that we are taking a pre-picture, I promise you, it will not be worse. It will always be 10% better. And so it is so.
Very, very interesting that it's worthwhile. Botulinum toxin, as we learned in medicine, was a
Yes.
definitely negative that was, but the side effect of one has been learned to take care of the good effects of it at the right places. The
So,
good part
so
about
So sorry to interrupt you, but if you do not go to an experienced doctor who has done many, even an experienced doctor makes mistakes. It's not that we don't. But if a client values her face and does not go to an experienced doctor, if the doctor, because it is very precise, as you know, Himanshu, you also deal with Botox. I mean, Botox cosmetic was invented in an ophthalmologist chamber.
yes.
So if it is not given in the specific muscle, you could have an eyebrow going up, another one coming down, an eyelid, closing, and taking 3 months to reverse. Luckily, all these are reversible. So it takes about 3 to 4 months to reverse. Sometimes the clients forgive you, sometimes they do not. You've lost a client. But these things happen. But it is very important to know, like Dr. Arthur Swift from Canada would say, it's important to know your injection anatomy. So go to doctors who are real, who know their work well, who have enough experience in that, so that you are not ended up having any weird this thing. Some people can't smile at all because the two muscles that make them smile here are affected. So
That's right. So Botox, there are, basically we use for blepharospasms in ophthalmology,
absolutely.
where there is this clinical. So that's how it started originally, and
Squint, blepharoplasm. Yeah.
correct, correct. So the answer to Botox is nice, worthwhile, not a problem, no long-term side effect. The good part of the story is that there is no long-term side effect, and the bad part of the story is not no long-term side effect because you have to repeat it ever so often in 4 to 6 months.
Yes, absolutely. That is the one thing that people say, oh, mujhe bar bar aana padega.
Yes.
But it's quite addicting. And so people do have come bar bar over the years.
During office time, they could just come during their lunchtime and get it done.
Absolute lunchtime procedures, it was called before.
Correct. And what about fillers, ma'am? There's a little more misunderstanding about fillers and the understanding. Sodium hyaluronate, the most compatible tissue, which is there in
Absolutely.
our joints. It's there in the eyes also. We have the vitreous field.
Yeah, right.
So just expand a little on fillers.
So it is a ground substance of our own skin, hyaluronic acid, like you said, exactly in the joints, in the skin, but as we age, the hyaluronic acid content reduces, causing dryness, causing add to it the migration of the fat pads, etc. So you get all these hollows where you don't want, which makes you look tired, or when you're not, it makes you look much older than your age. So these fillers are made from hyaluronic acid. They're of different consistencies, the softest being used for the under eye area to mold it well, and the lips, then the medium ones being used for, kind of maybe lifting the cheek, filling up the nasolabial, etc. And the strongest of them, where we need to restructure the bone. For example, the mandible, the jawbone has become thin because of aging, because of resorption, or Indians are born with a small chin and a retrusive chin. Mostly, we, in comparison, when you say one third, one third, one third, the lower third is always shorter. So if you want to make it absolutely this thing, then we use the thickest of the concentration of hyaluronic acid. These come in pre-filled syringes. It has, most of them have a built-in anesthetic so that the procedure is comfortable. It is minimally invasive because we are using a needle, but it is quite comfortable because we use a numbing gel before injecting. And it is very important that, again, you choose the right doctor because it has to be done safely. The doctor has to know the injection anatomy, should know the circulatory system. Otherwise, sometimes we may have to come rushing to you, Himanshu.
Yeah, true. There's this such a thin line of demarcation. A lot of people could go to a beautician and do it. It's not there. The
No.
anatomy means the exact functioning of every muscle, the physiology, the boundaries, the ligaments, and every possible distinction, the Lakshman Rekha between one zone to the other zone, one not overfilling to the other one, and how to restrict yourself. What is the best part to fill, while not to fit? Is there any side effect of using any filler, and how long does the filler thing work?
The side effects mainly being bruising, pain, maybe short for short term, 2 or 3 days at the site of injection, which is the normal. More going to the next level would be, granulomas where it does not suit, any content of any ingredient from the injection. The patient is allergic to, or forms a granuloma, or forms an abscess, or anything like that. The final, I have to say it because it is mentioned everywhere, and it is not that it is absolutely not possible to happen. Even in the most experienced hands, it happens that the injection needle should never enter a blood vessel because and deposit the material, because if there is any anastomosis, it could also lead to blindness. So that is very important. But having said that, having injected for more than 21 years, I started injecting fillers also. So by the grace of God, that's what I said. We may have to come rushing to Himanshu, to ophthalmologist, if such a thing happens, because it is blindness, strokes, but it's very, 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 very rare. Like I always tell people, not to sell my, not to promote my business, that even an aspirin which is not handled well can turn fatal. So
Yes, ma'am. So I would say I would vouch with you for the same thing being an ophthalmologist. In practice, I haven't seen anybody going blind because of either a Botox or a filler. Nobody has ever come rushing to me. What you are saying,
thank you.
yes, absolutely something that a doctor should say, that there could be. But to go and penetrate the optic nerve behind, way behind, is a dangerous thing. And you have to be really out of your mind to inject in a wrong area. So unless you taken well precautions as a doctor, it's impossible to go near the optic nerve or fill it up and you have a vascular occlusion. So I agree with you. That is something which I have not seen in practice, nor have I heard any of my colleagues seen in the last 10 years or so. So a remote is not 1 in 100 chance, not in 1,000 chance, 1 in 1,000,000 chance that one may get it,
Yes,
which is less than 0.001% of our overall population.
yeah, absolutely.
Yeah. So the vaccines are more unsafe than that as of today. Now that
Yes.
we're onto this, ma'am, quickly a question on the whitening thing which has happened. It perplexes people that suddenly I've seen some of these younger film stars, their makeup has changed. They've changed the complexion of glutathione with vitamin C. What is this therapy? It's something very, very.
So glutathione is an antioxidant, like all antioxidants, vitamin A, C, E, and magnesium, manganese, whatever, selenium. It is like that, L-glutathione. But the thing about L-glutathione is it has the effect of what is suppressing the melanin. So the concentration of melanin coming up. So it has the effect of reducing the concentration of the melanin. But if anybody thinks that the skin from brown is going to become white, or the 1 or 2 exceptions of film stars that people have seen, that she was so dusky in a film 10 years ago, and look at her now. So those are very dangerously high L-glutathione doses, which are not allowed by any medical association in any country. So we have a limited thing, but people are really addicted to this with vitamin C. Along with vitamin C, the absorption of L-glutathione is very good. People see that their skin becomes brighter, more even toned, let's say, and they like it. The best part is it gives them increased energy. It helps, it increases their immunity. So now during COVID time, it is a great boost to take that. It increases, they feel heightened energy levels. So they do come to us. We never promise that it's going to change your color, that this is the color, this thing shade, you're going to become from this to this. No. And anyone who expects that, I think should not. And anyone who promises that, I think it could be dangerous.
So is it given intravenous, and how often has it got to be repeated?
So intravenous, it is given once a week at a very small dose, but once a week for 10 sittings. And then we tell them to take a break. And then we tell them to continue with their exercise and with your eating well, sleeping enough, taking their nutritional supplements in, and having lots of dark colored vegetables and fruit, which are rich in antioxidants anyway, in order to maintain what they have achieved. So though it is this thing, changing of color from this to that does not happen. It just improves the quality of the skin, maybe sometimes helps in reflecting light. And before I go, Himanshu, I think we should pay tribute to everyone who has fought this COVID. During COVID time, I felt very guilty I mentioned to you, talking about beauty and, when people are fighting for their lives. But it is a part of life. Everybody is sitting at home in a lockdown and, really not being able to go out, feeling whether it is safe to go out. At such a time, we're discussing a topic, but I think we're doing more out of sharing knowledge. Someone who has seen in 27 years, I've seen a lot of what has happened. I've made my mistakes, learned from it. So even during this time, I thought it may be okay when you insisted. But we salute all the frontline warriors. We sympathize and condole with everyone who has lost their dear ones. And I wish that everybody remains safe. And we can see that slowly the number of cases are reducing. So God be with all of us. And Himanshu, thank you for having me on this. I enjoyed talking. I love talking about my subject like we all do.
Yes, yes. Thanks, ma'am. I'll just add one more thing to all our viewers. Friends, it's extremely sad to see some resident doctor in Assam, another doctor in Tamil Nadu, his scalp broken open with the beating because oxygen was not supplied by the government.
Correct.
This is extremely sad. I want most complacent people who do not talk, they talk intellectual things outside. They do not support doctors at this point in time. I would send across a petition to file because something which has to be done. If they are going to do this to the corona warriors, if these doctors are beaten up like this because of lack of supply or some unfortunate death because they came to the hospital at the 4th stage, it is extremely shameful, pathetic. And believe you me, if doctors stop working in these kind of environments, let the society see what it is. You have a Baba claiming right now that doctors are against previous kind of things. Nonsense, absolutely. We do like yoga, we do like pranayam, we like all these things. Modern medicine is the smartest medicine which accepts its mistakes. We said remdesivir was not good, doesn't mean we are wrong. We learn from our mistakes. We are not adamant. We are absolutely rightful in what we are saying. And somebody goes to degrade modern medicine and the corona warriors across the country. It is shameful if the common man keeps quiet and does not take a stand with the learned.
For the doctors, yes.
Yes, for all the doctors.
For people who are fighting, yes.
I'm very keen to tell all my friends who are here watching this show that please be very clear about this. If most of these doctors go on strike for a day, okay, tell all these paramedical people not to ever go to allopathic medicine for treatment. It's not going to happen. We are not against them. But the fact that if a learned person of this country, educated people keep quiet at a time when the society is going through this stressful area and doctors are not being supported by their silence, it is shameful, ungrateful. Please see to it that you represent and tell the government this is no way that the doctors should be treated in this country. No way that a science of medicine which has been responsible. Why take vaccines? Why did you give your children vaccines? Why did you ever go and take medications? If you don't believe in this, don't ever practice it. But don't be double-edged. Don't talk like this. Try and support people who are there to help the society. They are doing the rightful thing. Nobody's adamant. And if these poor kids are being treated, ill-treated, and despite not being paid their wages, it is very unfortunate. And it may look very strong, but please do take care that you are being looked
Yes.
after, your family is being looked after very well. And for that to continue, please take
Yes.
care of the society, the doctors who are taking care of you. And on
Yes.
that note, ma'am,
Himanshu.
yes,
Well said.
yes.
You're right. We are all with you.
Thank you, ma'am. Thank you so much for being
Thank you
with us on
again.
this show. We didn't want to have negative news, so COVID. I didn't ask you much about that. Enough of negative that we have had from the media.
Yes,
We
I
want
know. There's
we want
enough.
some good news because I can see a sudden burst of activity in next 15-20 days. All these cosmetic stuff. Everybody wants to enjoy life. Everybody wants to meet and hug people, get their serotonin level, oxytocin levels properly.
Yes, absolutely.
And we
So,
look forward.
Himanshu, thank you for inviting me,
And
and Pooja and Navneet and Ashok Kumar, everybody, the team. Thank you for making it successful. I enjoyed it.
thank you,
Thank you
ma'am.
very
Thank you
much.
for your